Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the ophthalmoscopic view of retina. So, direct visualization of the retina through the pupil by an ophthalmoscope. It is possible to look at the optic disc, the central artery of the retina, and the vein artery crossings, the Macula Lutea area by means of the ophthalmoscope, and this is a direct visualization. For better visualization, atropine or any other anticholinergic drug is dropped on the open eye to dilate the pupil. The optic disc is visible using ophthalmoscopy. The physician can assess normal retina so that they can also compare that of the abnormal retina. They can assess papilloedema. Is there any type of edema in the optic disc area? Retinopathy like hypertensive retinopathy, diabetic retinopathy. Even they can assess the retinal detachment. So this is a way to visualize directly by means of a light from the ophthalmoscope. Ophthalmoscope is a torch with a lens with light, and it is very small device. It can directly visualize the retina. So here this is the optic disc from where the optic nerve come out. Okay, and central part of the optic disc is the optic cup here, and we are seeing the artery. Okay, artery here, venule here. Venule is little bit more, it has more diameter than that of the artery, but wall is thin. In case of vein or venule, arterial wall is thicker. Okay, we got that. And this area of the disc area is little bit paler than that of the surrounding area. But if you go laterally, we'll get the macula lutea. Here, this is darker. And center of it, we call it fovea centralis, that contains a lot of cones, large cones, for maximum visual acuity. So this is the retina, what is visualized by the ophthalmoscope, by the optometrist or ophthalmologist, or any other medical doctor or medical student can visualize this part by means of the ophthalmoscope. Okay, parts, just we'll go to the parts of retina so you can correlate everything. We have the cornea here, very transparent, then anterior chamber of the eye, then this is the iris. The gap in the center of the iris is the pupil. Pupil is not the structure, pupil is the gap in the center of the iris. Then we have the lens, and then we have the posterior compartment or vitreous chamber or vitreous compartment. This is the anterior chamber. This is the posterior chamber. We can call it the vitreous compartment. Okay, that is that. And this is the retina. This is the choroid. This is the sclera. Okay, and we have other structure like the ciliary body here and some ligament here, suspensive ligament for the lens. Okay, we look by means of ophthalmoscope this part, the neural part of the retina, not the pigmented part. We look at the neural part of the retina. We also look for the fovea centralis that is present in the center of the macula lutea. We look for the optic disc. Look at that. Optic disc is a flat area, little bit depression here. This is the optic cup area. Okay, this is not protruded inside it. Okay, if it is protruded inside it, then its margin will be obscure. We call it papilloedema. That is associated with increased intracranial pressure. Okay, so in the retina, we look for the optic disc area. The macula lutea, center of it is the fovea centralis. Okay, Okay, so if we go to the ophthalmoscopic view of the retina, here this is the ophthalmoscope, and it is the retina is visualized by the ophthalmoscope. Ophthalmoscope is also called fundoscope by the ophthalmologist. Okay, and the this part what we visualize we call it the fundus. So by fundoscopy we can look at the retina. This is fundus, the expanded part. So what we look for papular edema, blurring of the margin of the optic disc. Okay, here this is normal, very nice margin. So there is no papular edema. We look for papular edema, blurring of the margins of the optic disc seen in increased intracranial pressure, suppose hydrocephalus or intracranial tumor, the brain tumor. Okay, maybe due to head injury, some type of injury inside. There may be some bleeding inside. So there will be papular edema. Okay, so in that condition, the optic disc will protrude inside and the margin will be lost. Then we will get a term called red reflex, reddish orange glow reflected back from the retina. This glow, this is the reddish orange glow, is reflected back from the retina, visualized by an ophthalmoscope. Okay, so when we put the ophthalmoscope, the light goes there and it gives this color. Color is the reddish orange glow. This is called red reflex. Fundus is the posterior part of the eyeball that shows the nervous layer or neural layer of the retina, plus the optic disc and the macula lutea and the fovea centralis. Plus, we also look for the blood vessel. Is there any arteriovascular crossing? In case of hypertensive retinopathy, is there any exudate or microaneurysm, especially in case of diabetic retinopathy? Okay, we look for that. Here, this is normal, so nothing will be present here. Everything is normal. Okay. Fundoscopy, visualization of the retina by an ophthalmoscope. This is called fundoscope also. Okay. So, ophthalmoscopy, optic disc is the area of the retina where the optic nerve leaves the retina. This is not protruded inside the eye. Rather, it is almost flat with a central depression that we call it the optic cup. Optic disc is lighter than surrounding retinal areas, but the macula lutea is darker than that of the surrounding retinal areas. Branches of central artery of the retina, that is a branch of the ophthalmic artery. Ophthalmic artery is a branch of the internal carotid artery. Okay, so central artery of the retina is very important. This is one of the end artery, artery without collaterals, artery without anastomosis that supplies the retina. Spread outward, it will branch out in the optic curve, around 4 branch initially, outward from optic disc. Optic cup is the central depression in the optic disc. Normal cup to disc ratio 1:3, but it may vary. It may vary because it may be different in case of glaucoma, in case of long-standing diabetes, in case of increased intracranial pressure. So also in case of increased intraocular pressure, in case of glaucoma, then we'll get the cup to disc ratio will be altered. Even it will be altered as the part of the aging process. Lateral to the optic disc is the Ulysses macula lutea. Fovea Centralis is the thin center of the macula lutea for maximum visual acuity. Rods are light-sensitive receptor cells that function to dim light. Cones are light-sensitive receptor cells that respond to bright light and are sensitive to colors. Okay. And that's all about the retina and ophthalmoscopy in a normal person. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. And have a nice day. Bye now.